When you vote in the 2024 general election, you decide more than just our elected officials. This year's ballot features 3 proposed constitutional amendments. The University of Arkansas System Division of Agriculture Public Policy Center and our 2024 voter guide provides research-based information to help you make an informed decision on Election Day.
Issue 1 is a constitutional amendment from the Arkansas legislature that would allow them to establish scholarships for students attending vocational and technical institutes in the state using funds from lottery ticket sales. Currently, the state constitution says these funds may be used for scholarships at 2- and 4-year colleges and universities in Arkansas. Voters approved the state lottery amendment in 2008. With Issue 1, it's anticipated that legislators would introduce additional legislation to define scholarship details, including what qualifies as a technical or vocational institute. Issue 2 is a constitutional amendment proposed through the citizen initiative process. With Issue 2, local voters in charge seeks to repeal the state's authority to issue a casino gaming license in Pope County. Voters in 2018 approved Amendment 100, establishing Pope County as one of 4 locations in the state where casino gaming could take place. In addition to removing Pope County as a location for a casino in the state constitution, Issue 2 would also require voter approval in countywide election should there be any additional casino licenses approved by voters in the future. Issue 3 is a constitutional amendment proposed through the citizen initiative process that seeks to expand the Arkansas Medical Marijuana Amendment that voters approved in 2016. Regarding medical marijuana, Issue 3 would expand the state's medical marijuana program in several ways. With Issue 3, Arkansans for Patient Access seeks to prohibit state legislators from repealing or changing constitutional amendments without voter approval unless those amendments specifically allow them to make the changes. More healthcare professionals would be able to certify patients for medical marijuana cards under this proposal. Currently, only doctors can certify people for medical marijuana cards issued by the Arkansas Department of Health. Issue 3 would allow nurse practitioners, physician assistants, and pharmacists to certify people for medical marijuana cards, in addition to doctors. The proposal also would expand the number of medical conditions that would qualify a person for a card. Currently, the state constitution lists 18 medical conditions. Issue 3 would change the law to add any debilitating conditions a patient has that healthcare practitioners consider might be alleviated by the use of marijuana. Issue 3 would allow people to use telehealth or video calls to see a healthcare professional for their initial appointment when they are seeking certification for a medical marijuana card. The proposal would also remove the annual $50 application fee that a person pays for the card and extends the expiration date from 1 year to 3 years before patients have to reapply through the state. Cardholders 21 years and older or their designated caregiver would be allowed to grow up to 14 marijuana plants at home if Issue 3 passes. Households would be limited to 7 smaller plants and 7 larger plants, regardless of how many cardholders live there. Dispensaries would be allowed to sell marijuana seeds or plants to cardholders, and they would also be allowed to sell pipes, rolling papers, and other paraphernalia they are currently prohibited from selling. Issue 3 would change specific language regarding advertising and packaging restrictions for dispensaries, processors, and cultivation facilities, and replace that wording with general language saying that advertising and packaging cannot appeal to children or be easily opened by children. If marijuana were ever decriminalized by the federal government, Issue 3 would allow adults in Arkansas to possess up to 1 ounce of marijuana for personal use. It would also allow the licensed cultivators and dispensaries in the state to sell marijuana at the wholesale and retail level. Finally, Issue 3 allows the state to be sued if any of the provisions in this proposed amendment are not enacted.
We hope this information has been helpful to you. For a more detailed explanation of each issue, along with what supporters and opponents are saying, check out the Public Policy Center's 2024 Voter Guide, along with other resources on our website at uaex.uada.edu/ballot.